Back in Arizona now, and the news so many are feeling hopeful about. If you're age 16 or older, you're just days from being eligible for a COVID vaccine.
Yeah, so many of us, Steve, seeing that alert on our phones and our state becoming one of the first to make this move. So how does it all work? And will the system be able to handle this huge rush? Our NICOLE VALDES kicks off our coverage tonight.
Well, the expansion starting Wednesday could be a game changer for Arizona. Plenty of people celebrating, but still some questions. Some people wondering what this means for the future of schools, sports, and our state as a whole.
Everyone's eligible.
And sooner than even health experts expected.
That's a very good sign because we're just that much closer to the light at the end of the tunnel.
But some still see a potential for problems.
Here comes the chaos.
Jessica Carey Alvarez has a daughter who's diabetic and an essential worker. After Arizona shifted its eligibility criteria from occupation-based to age-based, her daughter had to wait until now.
It's going to become a Hunger Games situation, and we're just going to be glued to the computer trying to find a vaccine.
Kara Carlson shares a similar fear.
It will be a challenge for them. There will be an element of competing with the healthy population.
Her worry that Arizona's disabled population may struggle with access overall.
Things that are really simple for you and I can pose difficulties for people with disabilities. There's a number of different ways to ameliorate those concerns, either by using a special hotline or going through the support coordinators.
So we asked the experts. Health Services Director Dr. Kara Chris says those with disabilities will have help.
We'll be working directly with our partners at DES and with some of our advocacy groups in the community to schedule vaccination events specifically for them.
On scheduling, our state's former health director, Will Humble, says,
I don't expect to see the same kinds of supply and demand problem that we saw back in January.
Because you're not limited to going through just the state or even county to get a shot anymore.
There's a lot of places you can go now that you couldn't go before. Now we've got the retail pharmacy program, which is direct shipment from the federal government. The community health centers are getting vaccine shipped directly.
And with some high schoolers now able to sign up to get their shot, could there be an impact on schools and extracurriculars? We asked our own education expert, Danielle Lerner.
I think the hope would be that with more people having access to and getting the vaccine, that community spread continues to come down, that teachers and families feel more comfortable with that in-person option, and potentially we could see some of those extracurricular activities or even school athletics start to resume.
In Phoenix, NICOLE VALDES, ABC 15, Arizona.
Okay, so that's the plan at the state-run sites. What about the county level? Tonight, Maricopa County saying they will align their operations with the state. So that means appointments at the county sites are going to open up starting at age 16. So Pfizer can go to those who are 16 and older. That's approved. 16 and 17-year-olds do need parental consent for that. Moderna and Johnson & Johnson, meantime, can be booked for those 18 and older.